So welcome back to French Ear Trumpet. Sorry about the gap in service last week, but I've had a terrible cough and Jane's not been well, so unable to broadcast through this media, sadly. But we're back now. But if I do cough through it, you'll have to excuse me. I'm sorry. It's just sort of hanging on. So my name's Colin. My channel is called French Countryside Life. This is Andy, and Andy's channel is called AJ in France. Two channels, same but completely different.
Yeah.
I think we both approach things in a different way, which is refreshing and interesting. So this week we're going to be talking about something that's quite relevant to certainly to my situation this week, and that is healthcare in France. Now, the healthcare in France, certainly how it relates to the healthcare in the UK, is vastly different, and it's set up in a completely different way. The best way I can describe it is that the healthcare in France is almost set up like a private healthcare system, whereby should you need any treatment, you approach the caregiver directly, and it's sort of you're sort of left to your own devices. I certainly found when we first came to France, and I didn't understand it. I actually came a bit of a cropper with that because I didn't know what the situation was and how it works. So I'll go into that a bit later. How would you describe the differences in the healthcare between France and certainly the UK? I mean, that's the experience that we've got.
Yeah, it is completely different. You have a lot more control here and a lot more say in what happens. So by that I mean, in the NHS, if you have a problem, you go to your GP, and your GP then decides everything after that. So he might say, right, you need to go to a consultant or whatever. But over here, you can directly book with I don't know, for example, a dermatologist or someone like that, and go and get an examination. So you don't need to be referred. So there's that aspect, and of course you pay, which is the big difference. Now, I think we better explain how that paying side of it works, because it's not completely private. So if you need treatment, a part of it, or a majority of it, will be actually funded by the government.
Yeah. So from what I understand, the state pays 70% of the cost, and the other 30% is covered by yourself. But the vast majority of people will have top-up insurance. Now, Jane and I pay about 600 euros a year for our top-up insurance, 600 euros each. And that top-up insurance covers everything. So we don't pay for any prescriptions directly. Just don't pay for anything else, basically. So between the 70% that's covered by the state and the 30% that's covered by the insurance, it's not free because you're paying for it, but it's there's no cost to yourselves, basically, other than.
Yeah, and that doesn't mean that if you can't afford it or you're poor, you don't get healthcare, because there are state systems that will provide that other 30% for you if you're unable to afford it. Yeah. Also, there are schemes in which, so if you're self-employed, then you get a special scheme which you can apply to, which is much cheaper than normal. when you get a job in France, sometimes that extra bit, that 30%, which we'll call a mutuelle, because that's the name for that 30%, is included in your contract, so you don't pay for it. But not all mutuelles or the 30% insurance are the same. So you have what we would probably call the top tier, where 100% of everything is covered. And it actually says that on your little slip or whatever you've got with you when you go to the hospital or doctors, everything is covered. But there are others that just cover a small amount. So they might cover just 75% of the cost of that 30%. I know it sounds really complicated, but there are different insurance companies who cover different things. And some mutuals, for example, only kick in if you stay overnight in hospital. So they're much cheaper, but they only pay out if you have to stay overnight.
Yeah.
Now, for a fit and healthy person, it may not even be worth your while to take out a mutuelle, but just put some money aside.
Yeah.
So I've got some anecdotes about how much it costs for various things for later on, but that's what happens. So most of it's covered by the state, and then a small amount, the 30%, you have to cover yourself. Whether you do that for insurance or you do it for your own money, that's entirely up to you. It's worth mentioning, I think, that anybody with a long-term illness, so that would be anything cardiac, cancer, or Parkinson's or anything like
Diabetes,
that doesn't apply to those conditions. That's covered entirely by the state.
Yeah.
Which we've got experience with. And I can only say that is a really, really well put together system.
Yeah. So let's just look at the two scenarios that you would need to access healthcare. So scenario one being you have an accident and you need immediate care. And scenario two being you develop an illness that needs treating. So we've both got experience of both types. So let's have a look at scenario one. So certainly in the UK, if you need to summon help, you would dial 999, and that would give you access to all of the emergency services. Completely different here. So to phone for the police, whether that be Police Nationale or Gendarmerie Nationale, is 17. So you dial 17. The Pompiers, which I guess is the most commonly used, isn't it? Is the Pompiers are like firefighters, but also paramedics to a certain degree.
Yeah.
I'm not even sure you call them paramedics actually, but
no.
But certainly fast first aid.
Yeah.
So you would dial 18. SAMU, which is I've written down this in French. Service d'aide médicale d'urgence. So it's the French Emergency Medical Assistance Service, basically. So that would, as far as I understand it, that actually runs through the local hospital. So there'll be a doctor available to direct the appropriate care.
Yeah.
Whether that be sending the Pompiers to come and scoop you up or an ambulance, whichever. So that's 15, and I think there was a service that you used, which is actually for the deaf and hard of hearing, which is 114, but you can do it online.
That's right.
And with text. So the address for that is www.info.urgence114.fr/. So we'll put that into the description. So you can communicate with the emergency services by text.
I think we should just probably, I'll tell the story about that because it might
Yeah.
help illuminate what we're getting at there.
Yeah.
So I'm an English person living in France, and at the time I didn't really speak French well at all. And I returned home one day. Well, by the way, there is a video. I did video the entire thing, and it's on my channel. We'll try and get, of course I did, try and get a link to it. But this was during COVID as well, so it was quite interesting what happened. Anyway, so I came home one day, and there was a guy passed out outside my house on the verge and he had a Alsatian dog with him.
It was a hot day, wasn't it? If I remember.
Yeah, it was a really hot day, and I went over and tried to wake him up. And I checked his pulse and he was breathing, but I couldn't wake him up. And I thought, well, if I was back in the UK, I would definitely call this geezer an ambulance. Anyway, so I thought, well, how am I going to do it? So I went inside and got my laptop out, went to that address that you were talking about, and you can see it on the video. In this case, there was a woman that appeared on the screen, and next to it is a text box, and I had a window open with Google Translate, so I could just write what I wanted, copy and paste into that box. So I translate it, Google Translate, put it in the box, and then send it to her. And it's really easy to do if you don't know how to speak French. And in the end, she said, "Okay, no problem. I'll send the Pompiers." And this was in the middle of COVID when everything was going completely nuts. About 12 minutes later, I had a full Pompier van outside, and they scooped him up, like you said, dealt with him, took him to hospital, all sorted. But that's a really, if you're watching this and you think, how do I call for help? Then that's an option, and it is worth watching the video to see that that's possible. And it is worth mentioning that if you don't have a plan on how to call for help, I'll give you an example. If you have a partner, wife or husband or whatever, you're out in the garden and you injured your neck or your back or whatever, you're then immediately relying on your partner to go and call someone to come and help. If they can't speak French, then it's difficult, really difficult. It's worth mentioning as well, of course, you can dial 112, which is the European emergency number. It's a bit like 999, and they'll help you out. And on that number, there is a good chance you'll get someone who can speak English. In fact, recently, a friend of mine had to go to hospital twice. Both times, when they call 112 or 15 or whatever, they found an English-speaking operator, but it's not guaranteed.
No.
So you need to have a plan with your other half, if there's just two of you or your family, to say, if something happens, this is what to do. Just have a
script, yeah. Have a script, yeah.
This is the address. This is who we are, and this is the problem. Written out in English and French, and you can talk to them on the phone. It's just so simple, and time matters in those kind of situations.
There's also it's called the SOS Helpline. It's open between 3 p.m. and 11 p.m. and it's an English-speaking service that can help you if you're having a bit of a crisis, or you're having a bit of a mental health emergency. And the phone number, which will be in the description, is 0146214646. But as I say, they're only open between 3 p.m. and 11 p.m.
That's a good one.
But it's good to know. But I think what you said about having a script by the phone, just because obviously the calls will be recorded, so even if you use just to rattle off
The address.
The address and the script. Go through the script.
Yeah.
Someone's gonna get that, and help will be on its way.
And the thing about here is the help does arrive incredibly quickly. I can give you another quick so my sister-in-law was in a road traffic accident.
A bad one as well.
Quite a serious one as well. And luckily she had a Peugeot which had the little SOS button.
Yep.
And she said that as soon as the collision occurred, within 10 seconds, somebody was talking to her through the car, Peugeot, saying, right, we know you've had an accident. We know where you are. We've already called the Pompiers.
That's amazing.
This was in like 10 seconds.
Yeah, that is
Talk
amazing.
to us, tell us what's going on, etc., etc. And then within 15 minutes, the road was full of red vehicles and flashing lights and stuff. And they all
just
went
amazing. Just amazing.
But,
that sort of system's life saving, because
absolutely.
As I'm sure you're saying, it's the seconds that count.
Absolutely, and that is a really good system. So if your car gets off, if you have that in your car, it does save lives. It's amazing.
Yeah.
But the speed of the response is usually very good. But, and I will say the difference, and I never understood this. So in England, I have a lot of experience with ambulances and being called out to life-threatening situations and non-life-threatening situations. And it doesn't matter which one it is, they always send a fully crewed, top-of-the-line ambulance with all the gear in and the people in it that can literally save your lives. But they will send it to everything. So in England, you'll get a full-on emergency ambulance for every incident that happens, but it's not normally necessary. So going back to what you were saying before, when you call SAMU on 15, there's a doctor, and he's trained in this kind of thing, and they will say, well, you don't need a full-on ambulance or doctor or that kind of thing, or the helicopter. They've obviously got helicopters, but what we will do is send you an ambulance to scoop you up on blue lights. They'll give you oxygen and take you to a hospital. So you don't actually stress out the emergency top of the line ambulances, and they're free to go then and deal with something else, which I think is a very good idea. But in England, if it's a call and an ambulance is needed, you get the works.
Yeah, that's interesting.
They're not able to do anything else then.
Yeah, my experience of what I was saying earlier about not really understanding the system. When we first got here, when we first moved to France permanently, I was cutting back some brambles at the top of an embankment, and stood back to admire my work, tripped over a root sticking out of the ground. I went flying backwards about 6-8 feet, and landed on my back. Bashed my elbow, and didn't think that was, it just hurt a bit. Anyway, over the next 24 hours, it swelled up, and I thought, I better go and have a look at this. So, cut a long story short, went to the local A&E. They did probably 20 X-rays, and I was the only one in the. Once again, I was the only one in the A&E. I had 3 doctors knocking about, looking at all the X-rays, and they said, yeah, it's definitely broken. And so I saw a consultant who said, you're going to need physio for that. I said, okay. Now, back in the UK, that would have all been arranged by the, by the hospital.
Yeah.
So he gave me this bit of paper that I didn't know what it was for, and it just had a date and a time on it. So okay, so about 6 weeks later, got to this date and time, went back to the hospital with this bit of paper, and went to see the because I'm thinking, well, 6 weeks to wait for physio, that's probably not great. So I went into the the room where I was supposed to be at this date and time, and the consultant was sitting there. I thought, well, that's strange. So he said to me, have you done the physio? I said, no, I thought the physio was today. And he just looked at me as if coming over here,
English,
winning bingo. And yeah, so apparently the bit of paper that he gave me, other than the appointment for the follow-up to see the consultant, the bit of paper was to go and get the physio. I didn't know, because if you need physio, they give you the prescription, and you go and find the physio, and that bit of paper pays for the physio.
Yeah, absolutely. It's really weird.
Yeah, but because I didn't understand it, because I didn't know what was going on, I was too late to have the physio, and now I can't straighten my arm. Can't straighten my left arm because it's that ship sailed. But
that's unfortunate.
Yeah, but
it's interesting because if you remember when I was helping you with your bathroom, I suffered an injury which required a accident emergency visit.
Yeah,
and I got a slice on my leg from some tile. In fact, there is a video. So that would be interesting to see. Went to you happily took me down to was it Conflon?
Conflon, yeah, Conflon A&E, yeah.
A&E, and basically got there and there's no one else there. Oh no, there was one guy, but I don't know what he was there for because he just walked off in the end, and I think he was waiting for someone on maybe. But in there.
Fill up waiting more than 5 minutes.
Yeah, and they had the waiting list times and stuff in English as well as French, didn't they?
That was funny.
Because you live down in that kind of area, don't you? Yeah. Anyway, so go in there, give you details, and I pushed a piece of paper over from our mutual. That was it. Went into the waiting room. We sat there for not too long, about half an hour something, if that. And then doctor comes in. Right, that's it. Straight into a room, get assessed, cleaned out, stitches, and then the question was asked, when was your last tetanus? I was like, well, I don't know. Oh, don't worry about that, we can do a test. So they did the old blood test, it's just like a pinprick on the finger, and I'm thinking, oh yeah, I'm all right, no worries. Comes back, I don't know, sorry. And I'm like, okay, so what happens now then? And this nurse comes in with a syringe that looks, I thought it was for a cow. We must have been doing veterinary surgery on the side because it was massive.
Yeah.
And she was like, right, take your trousers down. I was like, well, hang on, go buy me dinner first. I mean, anyway, it's the most painful.
Flowers.
It was the most painful injection ever. And I well, obviously it wasn't that long. It was probably about that long. Yeah, she had to take a run up. It was like jousting, basically. Yeah. And I was like, and then she went, oh, good news. You've got to have another one. I was like, oh my God, when? And she said, oh, in about, I don't know when it was, 6 weeks or so. I said, all right, fine, no problem. And she said to me, look, just go to your doctor. Here's the prescription. And they'll do it for you. And I said, well, my doctor's retired, so I don't really have one at the moment. And she went, oh, no worries. Here's a prescription for someone to come to your house and do it at your house. But also, here's the prescription for the actual medication. Yeah. So this is something that's different.
Yeah.
So I took that, went to the pharmacy, and we actually got given the vaccine to take away in a little while.
Yeah, put it in our fridge, didn't we?
Yeah, I kept that in my fridge.
Yeah.
Until the nurse came round, and then Go on.
That's another thing that's different. That should you need nursing care, you get given a prescription for it.
Yeah.
When I say nursing care at home.
Yeah.
You get given a prescription for it, and you just phone up a nurse, and they
Right.
come around and do whatever's got to be done, and pays for it.
In fact, you can actually go on.
No, I was just it's amazing.
Yeah, it is. And there's another video we've done about working alone. And my brother actually suffered an injury at work, called us, and we went down there, and he'd done something to his ankle. Mm-hmm. So once you work through the video, you see that he gets to hospital, gets dealt with, and he gets sent home. But then they actually send a nurse every other day or something like that to inject his leg to make sure that the blood doesn't clot, and they come to your house. They don't. You don't have to.
Yeah, that's great.
So that's a different situation. But getting back to this is type 1, where you need an accident and emergency. I think we're pretty much there.
Yep.
The waiting times in A&E are, from what I've done, I've been to several, and they're pretty small.
I mean, I talked about it before, but when I cut my hand with the utility knife, and I thought, that's bad. So I went to the same hospital that you went to, as you know, and went into the little slidey door, and there was a nurse sitting there, and I told her who I was, and so did all the formalities. She said, just go through the door, go through the slidey door. Went through the slidey door. She ran out the back of the office, opened the door to the waiting room, said, right, you can come through. And I think I said the week before, that I got sat on a treatment bed, and I was the only one in the whole place, but I had to wait 20 minutes for the doctor to finish his lunch before he'd come out and have a look.
Very French. So I've got 2 stories or anecdotes about emergency, more serious, I think, emergency things. So when I first got here, before I was even in the French healthcare system, I needed to get an emergency ambulance, me personally, from my house to Rennes, which is the nearest big hospital. You can actually pick which accident and emergency you go to. I don't know if you know.
No, I didn't know.
I just said, which is quickest. So we went there, and I got an ambulance ride up there, got taken in on a stretcher. Again, it's during COVID. And within a minute of getting there, I was straight into a treatment room with all the machines on me that you need to do. And I was there for a couple of hours. I saw doctors, I got ultrasounds, I got every single thing done in a private room, which was amazing. They brought out the ultrasound scanners and everything, and they properly and did all the blood tests, everything in a couple of hours, and then I was released with medication. Now the problem is I didn't have a mutual, and I didn't have any healthcare in France whatsoever. I did have, at the time, it was called an EHIC, European Health Insurance Card.
Yeah, it's like a reciprocal care, isn't it?
Yeah, which the
Allegedly.
Conservatives rebranded as GHIC because they didn't want the word.
Excuse me.
And so I then was faced with a bill for an ambulance ride, ECGs, ultrasound, medication, prescriptions, everything. And I was thinking, man alive, this is going to be expensive, because it only covers you for the state portion. So it only covers you for your 75%. Anyway, I got the bill. It was 107 euros for all that.
Yeah, that's mad.
I was like, yep, all right, I'll pay that, no problem. And so I was over the moon with that.
Brilliant.
So that's if you have to pay for it.
Just while we're talking about that, 2 things that I keep by the phone. There's a little table there with French numbers,
Mm.
just in case you get a bit of a a bit of a mental block
Yeah.
on the phone. And something else that is really helpful, actually, I've used it quite a few times. It's actually the French alphabet, but it's done phonetically.
Ah, nice. Yeah, good idea.
Yeah, so trying to say your name over the phone or your address and trying to spell it.
Under
The
stress.
phonetic alphabet in French is quite different. So that's useful. So maybe print those off and keep them by the phone. You never know.
Yes, good, really good point. Like we're going back to earlier, always have information there ready to go because it's the time the stress hits you, and if you're not used to it,
Preparation.
yeah, you just forget everything.
Yeah.
Even if you can speak French, you just forget it because of the stress.
Yeah.
This my second anecdote about that is it was my brother's birthday, and I was taking my mum to Rennes to go to a restaurant for dinner, and she seemed a bit uncomfortable when I first started the journey. I was driving, and we got probably to the outskirts of the town, and I said, "Look, you don't seem right. Are you all right?" And she said, "No, I'm not." And she looked at her phone, her watch, which was connected to her phone. It's one of these Samsung. I bought a Samsung smartwatch, and her heart rate was something like 200 beats a minute.
Wow.
And she said, "I don't feel very well." I said, "Right, we're going straight to the A&E. Hold my beer." No, I didn't say that. So I must have done about 100 miles an hour round the ring road straight into the A&E. Straight in there, took her straight through the front door, and then we still had to get booked in, which was weird because he didn't come by ambulance. But it was obvious my mum wasn't all together there, and they took her straight into a triage, asked her what was going on, and but where I am, you need to speak French. It would have been impossible to explain what the problems were if we didn't speak French, because nobody speaks English here. And then that was it. I didn't see her. I was just in the waiting room, called my brother to come down, and then my mum texted me and says, "I'm feeling a lot better. They're going to keep me in this afternoon, but they've diagnosed a problem with my heart." And I was like, "Okay, fine. Is it serious?" She said, "No, it's not serious, but it needs monitoring and medication." So they put her on medication. Anyway, you'll see this. It's actually in a video. I did a video on this. I went back to pick her up, and it was a night of a massive storm.
Right.
And I was driving back from Rennes, and I thought trees were going to fall in the road. It was that bad. Anyway, so the next day, about 8 o'clock in the morning, we get a phone call, and it said, "Oh, it's such and such from the cardiac unit at this hospital. Right, we need you in to see the consultant. Can you come next week on Monday?" I mean, that waiting time between that and that is unbelievable.
Yeah.
Yeah. Again, it's the A&E side of things is pretty good in that respect.
Was your dad diagnosed in France, or
Yes.
So Dad went through the complete illness in France?
My dad did, yeah. So for those that don't know, my dad had Parkinson's, and when he retired out here, we started noticing little things, and then he wasn't feeling right all the time, and eventually, it got diagnosed over in France. So Parkinson's is one of those, once it gets diagnosed, like we spoke about earlier, it's an ALD, affliction long durée. Anyway, it basically means like
it's a chronic
it's a terminal illness, really.
Yeah.
So it's all 100% covered through but that was done through the GP service, if you like, initially. And they tested him for absolutely everything, because you don't know what it is. So they went through everything. And I remember him telling me a story. He went to a hospital and they said, look, you've done all this, blah, blah, blah. You're going to need an MRI because that's the only thing left that we haven't done.
Yeah.
And they said, he said, all right, so when do I come back for that? And they went, oh, about 30 minutes. It's just down the hall there. Literally, like that.
That's amazing.
Yeah, so anyway, eventually got diagnosed, and then the care after that was, I can't really fault it, to be honest.
Yeah,
that's good. Really.
So just looking at the second scenario where there's, where there's a medical diagnosis.
Yeah.
This was. We'd been in France for about a year, I suppose, or just slightly less than a year, and where I was lifting stuff all day and working, I'd got a lump come up in my groin, and it was clearly a hernia. So I went to our GP, which you could pop in and see. What I used to do was pop because it's difficult on the phone, so I used to pop in and make the appointment for like 2 or 3 days, which is fantastic. So went to see the GP. He took one look. He went, yeah, that's a hernia. I was like, all those years in medical school weren't wasted, haven't I? So he said, yeah. So give me a letter, give me a referral letter, which you don't really need, but I had it anyway. Went to the hospital in Laval, which is like a big regional hospital, and made the appointment to see the consultant. And they gave me a big sheaf of papers, and one of them was to get transport.
Yeah. Oh, yeah. Of course. Yeah.
So when I went to see the consultant, about 3 or 4 days later, went to see the consultant, and he said, yeah, definitely sort that out. And he looked in his diary, and he was like, Thursday, all right? I said, yeah, fantastic. And so he said, yeah, go and see the secretary down the hallway, and she'll sort you out, give you all the appropriate information. So I went down the hallway, see the secretary, and I said, look, I've got this bit of paper that says I can have transport. I said, I don't really know what I'm doing. Can you explain that? She said, yes. She said, there's ambulance cars that will pick you up from home, take you to the hospital, and then after the procedure, they'll take you home.
Yeah.
So I said, okay. I said, can you recommend one at all? She said, I'm not allowed to recommend one. So as I'm standing there talking to her, I'm looking over her shoulder out the window, and there's a great big building opposite the hospital that said ambulance, taxi. So I said, what about that one? She looked at me, she went, yeah, that one's fine. So I went across the road and showed them this bit of paper. They went, yeah, no problem. Leave it to us. So the morning of the procedure, I walked down our lane, and I was waiting down the bottom of the lane about 6:30 in the morning, so it's still dark. And I see this yellow light on a car coming down the road, and I think, okay, fair enough. And they pulled up, and the difference with the taxis, certainly the ambulance taxis here, is that they don't just deposit you outside the hospital. They park up and they take you up to the floor and to the ward and hand you over to the appropriate staff member, which is amazing.
Yeah.
And so once I got handed over, there was this young fella who was a nurse, took me into it's almost like a private room, but had 2 beds in it, but the other one was empty. So and he gave me one of those gowns where your arse sticks out. He said, put that on, and so I got undressed, put it on, and he said, I'll be back in a bit to shave you.
Nice.
I said, okay, yeah, great, yeah. Hot towels? He went, no, knees to nipples. Okay. Knock yourself out. So he came back and put the curtains round, which is curious because I was the only person in the room, but anyway. And he had his back to me whilst he was getting all the shaving accoutrement ready, and he told me to take all my kit off. So I'm laying on the bed as nature intended, laying there, and he turned back round and he went, "Ooh la la," and he set to. He set to, and he was happy with his work that day. And
it's appropriate.
Yeah, and yeah, so that was interesting.
Wow.
Yeah. I thought I was going to have the procedure that evening, but that didn't happen. So the next morning, they took me down, had the procedure, woke up back in the little ward, and then the next day, I think I spent another night in the hospital there, which was brilliant. Food was interesting. The food was great. Obviously, I didn't feel like eating much, but the food was fantastic.
Ah.
And yeah, the taxi driver came and got me from the from the ward and took me home. And as it turned out, the two ladies that bought the house that we sold, they'd already, we were just in the process of the conveyancing at the time. They had brought some of their friends from Holland to come see the house. So I think I was still off in La La Land with the anaesthetic. So I didn't know where I was.
Brilliant.
So yeah, so we all sat outside and had a glass of wine and that, and it was lovely. But yeah, but I can't fault the entire system, right from seeing the GP right through the hospital procedure where they look after you all the way through, and I can't fault them at all.
Yeah, I mean, I have heard of some bad I don't know, experiences with the healthcare system.
I think maybe if you're how can I put it, in like a regional hospital, that's Normandy, maybe Brittany, I guess. But I guess if you start getting into the places like Marseille or Paris, certainly, the bigger city hospitals, then maybe see that would be a different story.
Yeah, I guess one interesting. I remember in 2018, my dad had a prostate operation.
Right.
He decided to opt for surgery as opposed to medication because he was reasonably fit and well then, and he was able to withstand the operation. I just remember him telling me on a video call, oh yeah, I was sat at home and there was a knock at the door and it was the surgeon. And I was like, right. And he goes, yeah, he just popped in on his way home to see if I was doing all right. And you're like, what? What kind of world is this? I mean,
proper civilized one, apparently.
I was back in London recently, and a friend of mine.
I was just going to ask you about that, funny.
Yeah, a friend of mine went to A&E, and they were there for 13 and a half hours before they were seen, and it wasn't a minor problem either. So And they said that there was just people everywhere in the corridors, just on trolleys screaming, and it's like a post-apocalyptic nightmare.
My brother was, he was basically dying, and he got picked up by ambulance. This is down in Cornwall. Picked up and spent, I think it was 16 hours in an ambulance outside the hospital.
Yeah, it's completely
he was basically dying.
Yeah, it's sad. It's really sad. If you call an ambulance, chances are, even if it does turn up, it's not going to be soon. But that's what I was getting back to earlier. Over here, they send a full emergency ambulance for everything. So they're then sat outside the back of the hospital in a fully emergency ambulance with all the kit in to save someone's life, and they're just sat there burning diesel out the back of the hospital. Yeah. And they won't accept them in because it adds to their waiting list.
Yeah.
It's all about numbers. So they won't take them off the ambulance, because the second they take them off the ambulance, it increases their waiting time. So it's criminal, really. But over in France, they select the kind of ambulance that you need. So you might just need scooping up. You might need the Pompiers, like you say, or you might need full-on doctors, and they will send an emergency doctor car.
Yeah.
With an emergency doctor in it, or they'll send a helicopter, or they'll send whoever based on what you tell them on the phone. So that's pretty good.
So for someone that's planning on coming to live here now in the post-Brexit world, do you know what they would have to do to access the healthcare system? Can you get a mutual, the top-up insurance if you're on a year's visa? Can you get a carte vitale, which is your your healthcare card?
I think, right, so it's very similar to the way I had to do it. There's not really much difference in that, because the big difference is you probably need a job or a visa, a sponsor or a visa or something to get over here. So the likelihood is you're going to get a job anyway. But you have to, and I had to, buy private healthcare for everything. So not reliant on the state or anything. And that was quite expensive. I think it was about £800 or €800 for 6 months. And you need to prove that you've got that to apply for your visas anyway. So you can get that from anywhere. And then during that time, the procedure hasn't changed just because it's after Brexit. You need to prove that you work here, and then obtain a social security number through your carte vitale, and it's quite a hefty file. But if you get a job, it's pretty much all done for you.
Yeah.
They do it all for you. But I didn't, so I had to do it all myself, and it's incredibly complicated filling out all the forms. But eventually, you will get a social security number. Once you've got a social security number, you can then apply to get your carte vitale. Once you've got your carte vitale, you can get rid of your private health insurance. But you need to have the private health insurance to prove to the state that you're not going to be a burden on them. So private health insurance, then you apply for your social security number and your carte vitale after that. It's and it's all done through the local office, which you'll have to Google which that is to wherever you live. But they're actually quite helpful, except I submitted my forms and everything before Brexit, and then Brexit occurred, and it was ages I didn't hear from them at all. So I went down there and I said to them, where's my, tell me about the progression of my case. She went, oh, well, it was Brexit, so we threw it in the bin. So I had to reapply from scratch. So I kind of did apply before and after Brexit.
Yeah.
But you just basically, you need...
Good job you went down there, though, wasn't it?
Huh?
It's a good job you went down there.
Yeah, I'll still be there. Yeah. So you have to prove your address, that you're resident, that you've got a job, or you're self-employed or whatever your income is, and you've got to prove that you've been resident for a certain period of time, and I forget what it is. I think it's something like 6 months or something like that. It's not a long time, but once you've got that, you're in the system then.
Yeah. I found I think we touched on it with one of the previous videos, in that a lot of the shops are what I guess you describe as closed shops, in that you can't buy paracetamol or basic medicines in the supermarket. So every type of medicine you can think of you can only get it from a pharmacy.
And they're on strike today.
Are they really? I didn't know that.
Yeah.
Well, the French are on strike. There's the thing.
Yeah, because apparently they're being undermined or some nonsense like that. I don't know, but yeah, literally anything.
Paracetamol, everything.
It does amuse me in the supermarket. They have like a little mini section, and there's like plasters, and cotton wool, and safety pins, and that's pretty much it.
That's your lot.
And then you have to go to a pharmacy for everything else. I did text you actually, didn't I? I'll tell you. I've got a really interesting thing to tell you.
Yes.
Right. And I only found this out a couple of days ago.
Yeah.
I can't give blood in France.
Okay.
Neither can you.
Is that right? I didn't know that. Condescend.
Yeah. And the reason is, if you've spent more than 1 year living in the UK between 1980 and 1996, I just made 96 up. It's somewhere over there, but it's from 1980 onwards. Because of mad cow disease.
Oh, really? I thought you was going to say talk about or refer to the to HIV. That because it was.
No, it's CJD.
Okay.
I don't know what it is in French. But you are not allowed to give blood because we were resident in the UK for more than a year between those dates.
Okay.
So you are no longer allowed.
All right. Well.
Never mind. But, it's strange.
I didn't offer.
It's just something I found, and I was like, wow, that's crazy.
Yeah.
Because we were all brainwashed at the time by the British government thinking, oh, this is all right. Everything's going to be fine. It's all going to be fine. And then... No, when you go and live abroad, you look from the outside in. It obviously wasn't. So
no.
Yeah, that's what I found out.
There you go.
For your info.
There you go. So we've covered the emergency calls. Just to recap, brilliant idea of yours to have a script prepared by the phone. Or in a prominent place, or maybe pop it in the car, or do a copy and put it in the car. Just a little script of potential scenarios. I think that's a really good idea. That's really good preparation. That.
Yeah.
Sorry.
No problem.
Yeah. And we've covered the numbers. Really, the only one that you really need to remember is 112, isn't it? Because you'd be able to access whatever you need through that. I think it may have been you actually who said to me that if you're unsure about any of the medical things, just call a Pompier because they will respond quickest.
Yeah, they will. And they love a ride out as well. So now they are pretty good. Also, something else to know: in France, they have what do you call it? Defibrillators in most towns.
Yes.
You're getting them in the UK now as well, but they've had them here forever.
Yeah.
But if you have your own defibrillator and you use it on someone and it goes wrong, you can be held liable for it.
Yeah. We used to have them in the cars when I was working.
Great bits of kit.
Yeah. Fortunately, never had to use it, but it was it was nice knowing it was there. I had to fight to get them put in the cars because the argument when I proposed that we should have them in there, because we've got really high net worth individuals in the car. Should there be a medical emergency of that level, as we said, seconds count. And but the argument was that if someone's having an episode where they would need a defib without oxygen, they make little or no difference. And obviously, you couldn't put oxygen into a chauffeur car because you'd need a HazChem sticker on the back of it, which obviously we wouldn't have. But no, I think they're brilliant, and these days they're so simple to use. They've virtually been made idiot proof. They talk to you. Mind you, probably in French, yeah.
That's what I was going to say.
Yeah.
So, if you have one, I've got one at the end of the street in the town square. Go and have a look. Look at the model number, and just go and familiarise yourself with it in English. I know it sounds silly, and you may never use it, but there'll be that one day.
Yeah.
Someone somewhere will need to use it, and they won't know how to use it, and someone's life could be saved. It could be their own.
Proper preparation.
You could be there with your partner, and you need to use it, and they don't know how, or you don't know how.
Yep.
Really scary. Yep. Knowing that the equipment there is to save your life, and you can't use it.
What they're thinking about.
Yeah.
So as I say, so we've covered the emergency medicine, and I think we've pretty much covered the routine medicine.
Yeah.
Is there anything that you'd like to?
I just want to give you another story, actually.
Yeah, go ahead.
Unfortunately, I don't know why. I seem to spend a lot of time in hospital. But my mum rang me one day about her knee had locked, or incredible amount of pain on her knee. She needs to go to a hospital. So we went to the A&E again, and super quick, straight in, no problem. But went straight in, and they said, well, there's no point in going and sitting in there. You're going to have to go for an X-ray. Wheel your mum down the stairs, down the lift downstairs. Go down there. This was lunchtime, and they'll give you an X-ray. So wheeled her into the waiting room for the X-ray, and within 10 minutes, someone comes out. Right, come on, you're in. Go in. Bring her out, and she's sat there waiting for a bit of paperwork, and she gets an email on her phone. She opens it up, and it's her X-ray, and she's still in the waiting room.
Yeah,
and it's automatically come through to her email. And not only that, she clicks on it, and it's interactive, so you can pinch to zoom, and you can zoom through the layers of the X-ray, right from muscle mass from the outside all the way through down to her bone.
That's mad, isn't
different it? Intensities of the thing. Just by doing that, you can zoom in and out through the X-ray. I was like, oh my God, this is unbelievable.
One of the other differences is that they give you your medical records. They give you your X-rays. They give you
yours, aren't they?
Yeah, they give you this stuff, and it's your responsibility to take it to the next
person or whatever
appointment. Yeah. Whereas obviously in the UK, you clearly can't be trusted with something like that. So they keep it all central, don't they?
Well, they do and they don't. They don't talk to each other.
No. Do you think it's often actually? I've found being in France. I mean, it's only a relatively short time I've been here, but I've found that the authorities do tend to treat you like an adult a bit more.
Oh, absolutely.
So
there's more responsibility for you to do the actual thing that you're supposed to do.
As an example, walking around the supermarket, there'll be there'll be a display that's that's being rebuilt or something, and they'll just leave all the bits everywhere, and just assume that you're not an idiot, so you won't fall over it. Whereas in the UK, there'll be yellow tape all around it, and people with
hard hats and clipboards.
hard hats and clipboards, yeah, and health and safety. Whereas in France, we'll just don't fall over it.
Yeah, we actually covered this on the last one when we went to the DIY store.
Yeah, that's it.
And I went to Builder's Merchant, and the wood was too long to fit in my van by about that much. Yep. So I get my saw out to cut it off, and the guy comes running out of the office. You can't cut that there. You know, what happens if you cut yourself? We're all, you can't use a saw here and all this business. And then you get to France and go to the Brico. On the way out, there's all sorts of saws and tools on chains.
Yeah, that's it.
You can use to saw your wood up with. It's
just
completely opposite. Yeah, no, I think they do treat you. So you have to carry your own medical records with you. Like we've already mentioned, the vaccine that I had for tetanus. You had to take the actual medication with you. Mm-hmm. They do that, but they also do look after you. So obviously, eventually, my dad was admitted to hospital shortly before he died, and we didn't think he was going to pass away. It wasn't on the cards at that time. And we had a woman come in. He was in a lovely private room on his own, and a woman came in and she said, "Right, I'm here to arrange the care for your dad when he goes home. What does he get at the moment care-wise?" Now, up until that point, my mum has been looking after him. I mean, and it was a 24-hour job. God, I don't know how she managed it, but she said, and my mum said, "No, I just look after him." And this woman was like, "What do you mean? What do you mean?" kind of thing. Yeah. And said, "Right, well, what we'll do is we'll send him from the main hospital when he gets better. We'll send him to a recuperation hospital near home." And they have these, and they used to have them in England called cottage hospitals, didn't they?
Yeah.
Where you can go and recuperate, and they get looked after. So they still got those here. And then we'll sort out a package where we'll get carers to come in twice a day or all day, or some parts of the day. We'll sort it all out. We'll get care to come in and look after your dad so your mum doesn't have to do it. And they were arranging all that in the hospital at the time. So everything is available. You can get care at home. I think where people have bad experiences because they don't speak the language.
Yeah.
And I think if you don't know what's available and you don't speak the language, find somebody like a hand holder or somebody who can speak fluent French.
There's any number of those around that you can find.
Yeah, to help you find out what is actually available to you, because there is way more available to you.
Well, funny you should say that. I got sent an email by the doctor's surgery to let me know that spa breaks were available. So for certain conditions, you can go on a 10-day spa break, if you like, recuperation. And there's certain conditions. So you see the doctor when you first go there. You see the doctor halfway through, and you see the doctor when you finish. And you must. I think it's about 20 different spa procedures that you must attend. So whether that be massages or hot stones in your ears, I don't know, whatever it is. all of these things, but you must take part basically. But it's basically 10 days in a spa that the state pays for.
Yeah, and I think
it's unbelievable.
So you just need to see what's available. Get someone that can help you. Especially if you're facing a long-term illness or an extended period of sickness, shall we say? Because there is always way more there than you think. But if you don't ask, you don't get. So
that's right. Yeah, that's it.
100%. Get someone in there that
knows. Know that it's available, and you don't know to ask for it. That's the issue. So that's why it's so important, as you say, to get someone who does know to guide you.
A friend of mine, he had heart problems, and he had stents put in the UK, and it failed. So they had to go in and put some new ones in, which they do over. I think it's an outpatient job now. I mean, it's
Right.
really that quick. But afterwards, they said to him, right, you've got to go to these exercise classes 3 times or 4 times a week. It was crazy. And he said, well, you know, how do I get there? And they said, well, can you drive? And he said, yeah. And he said, right, well, we'll pay your mileage. So the state actually gave him X amount of euros per mile to go and attend these events. So all that and more is available. You just got to get in there.
Yeah. Well, Jane had physio on her shoulder. She was having some issues with her shoulder, and I think she must have had about, I want to say 3 months. I think it was twice a week. Physio, and that was great. That was great, and that was just down the road.
It's funny because I know someone back in England. They get sciatica, and they went to hospital and said, right, well, you need a consultant to look at this. Anyway, they went back to Spain, got it all looked at, I think. And anyway, that's not the thing. The thing is, 18 months later, they got the letter from the consultant saying, right, you can come in now. 18 months.
18 months. Yeah.
That's all done and dusted.
You're either healed up or dead, aren't you, buddy?
Oh, yeah, exactly. Yeah. Well, I think we've probably covered quite a lot there, and it's about an hour in. So
yes, yeah.
I don't know if there's anything else you want to.
No, just that I sort of wish we'd have done this one before because it's really important.
Yeah. Have a look at my video on working alone on your own, because there's a lot of expats come over and work on their own, and there's nothing more frightening than being alone, injured, and not being able to seek help. Just simple steps, like if you're going to do something dangerous, like go up a massive ladder, or tell someone you're going to do it and say, right, I'm going to ring you or text you when I get down in 20 minutes. If I don't text you, call me. If I don't answer, there's a problem. This is the address. Send somebody to help. I used to do that when I was back in the UK when I was doing something dangerous. Just there's that backup there, and I tell you, I've seen situations where people are just fallen in the bath. My friend's neighbour, she fell in the bath, and she was there for over 9 hours in the bath because she can't get out to get hold of a phone, and she lives on her own.
Yeah, of course.
You know, you just have that backup plan in place, and I think a little bit of time spent now will save
proper preparation again, isn't it? That's what it is. I mean, that's what all these are about. You know, just thinking it through. What will I have to do? What will I have to say?
Yep. What's the most likely thing, especially if you've got health problems anyway? If you've got health problems anyway, you should be doing that anyway. You should be having a script by the phone.
Yeah.
This is the number. This is what to say. One last thing. There's an app called What 3 Words. Have you heard about it?
Oh, yeah. Yeah, it's fantastic. Yeah, I've used it many times.
Any place on Earth, you can say 3 words and it will direct you to a 1 meter square area on Earth. If you're out in the French countryside or even driving a car and there's something you need to get someone there, like Pompiers or ambulance, how do you know where you are? How do you explain that? If you can just say what 3 words and then the actual 3 words, it narrows it down by using 3 individual words to 1 square meter of land in the whole world. And they use that as postcodes in some countries, actually, but they have a look at that. That's well worth looking at, and you can add that on the bottom of your script.
Yeah, no, that's a really good idea. Yeah, I'd forgotten about that, actually. Good job.
All right.
Well, thanks so much for watching. Hope you've enjoyed it as much as I certainly have. And if you'd like to give the video a thumbs up, press the notification bell so that you know when there's new content. and maybe share it on your social medias, and maybe think about subscribing if you're not subscribed already. And all that leaves to say is goodbye from me.
It's goodbye from him.
Goodbye.